Cardiovascular disease, a global crisis claiming 17.9 million lives annually. We're constantly seeking breakthroughs. Imagine a natural solution, not from a lab bench, but from the ocean floor. Early data suggests blue mussels could hold the key. We're talking about peptides directly battling oxidative stress in endothelial cells, the true front lines of heart health. This isn't just a niche finding, it's a potential paradigm shift. Stay with me because the next wave of cardiovascular protection might just be found in the tide.
Now let's unpack the mechanism. Your endothelial cells, the vital lining of your blood vessels, are constantly under assault, especially from oxidized LDL. This stress triggers cell damage, even programmed cell death, apoptosis, a critical initiator of atherosclerosis. Marasinghe and Jez's work shows these blue muscle peptides intervene. They directly scavenge reactive oxygen species, or ROS, effectively shielding endothelial cells from oxidized LDL's cytotoxic effects. Think of it, a natural defense against the very process that sparks vascular pathology. What's more, these peptides aren't just direct scavengers. They appear to upregulate your body's own antioxidant systems, like SOD and catalase, bolstering cellular resilience. Marine organisms, evolving in extreme oxidative environments, are masters of defense. This dual-action approach from blue mussels offers a direct cytoprotective mechanism that targets the root cause of endothelial dysfunction, not just managing downstream symptoms, a significant differentiator in a crowded therapeutic landscape.
This isn't just fascinating science, it's a testament to nature's untapped pharmacy. My role as a pipeline tracker is to show you how these discoveries move from concept to clinic. This is precisely why staying ahead of the clinical curve is non-negotiable for informed leaders. You need to know what's coming and when. Dive deeper into the data with me at Peptides.today. The journey for these peptides is long, but their potential to genuinely improve lives makes every rigorous step worthwhile.
But let's be pragmatic. The voyage from preclinical finding to pharmaceutical product is notoriously arduous. These blue muscle peptides are firmly in the discovery phase. This means extensive in vitro and in vivo studies are still critical to establish a robust safety and efficacy profile before any human trials can even be considered. We need comprehensive pharmacokinetic and pharmacodynamic studies. How are these peptides absorbed, distributed, metabolized, and excreted? What's their bioavailability? Is there any immunogenicity? And of course, non-GLP, then GLP toxicology studies in at least 2 mammalian species are essential to pinpoint adverse effects and determine maximum tolerated doses. Only after this rigorous preclinical validation can an investigational new drug application be filed with the FDA. Phase 1 will focus on safety in healthy volunteers, Phase 2, efficacy in a larger patient group, and Phase 3, definitive proof of efficacy and safety in thousands. This timeline is typically 10 to 15 years, capital intensive, and with a high attrition rate. While a medical food path might exist, disease prevention claims demand pharmaceutical level scrutiny.
So, while blue muscle peptides represent a scientifically compelling development, a refreshing perspective on cardiovascular disease prevention, the path ahead is undeniably fraught. The mechanism is sound, rooted in antioxidant defense and cytoprotection, but we need clear data, stability, bioavailability, dose response, and comparative efficacy. It's a promising tide, yes, but the clinical development process is notoriously rough. The allure of a naturally derived, specific endothelial protector is undeniable, but it demands unwavering scientific rigor and substantial capital. Before we sign off, a quick legal disclaimer. This podcast is for informational purposes only and is not medical advice. All compounds discussed are for research use only and not for human consumption. Always consult a licensed healthcare provider for medical needs and treatment. Stay ahead of the clinical curve. The next great peptide is already in phase 2.